Welcome again. Welcome everybody to our YouTube channel. We are here to try to explain to you the best way we can do all the advances, all the challenges we take every day to try to make your gender surgery, in all the gender surgeries in general, in particular in phalloplasties, in vaginoplasties, and in new techniques such as the vaginal and peritoneal vaginoplasty. So we are talking about today. We are going to talk about overweight people and these kind of surgeries and gender surgery, because I'm aware many of my colleagues worldwide are rejecting patients for these kind of surgeries because of their weight. And unfortunately, we need to deal with big patients nowadays because it's becoming something very common for us in our surgical theaters to have very big people. So that's, in my opinion, not a reason to reject patients for a surgery, but it's a reason to explain to all my patients, to all my overweight patients, why surgeons are rejecting people because of their weight for gender surgeries. And in my opinion, it's not a question of rejecting a person. It's just a question of explaining to you properly why we have risks, when we take risk when people are overweight for any surgery, and in particular, in our case, to gender surgery. So when a person is overweight, the first thing we need to know is we won't get the same results than in a thin person. Okay, that's something very normal. If you take a look to an overweight person and a very thin person, you'll see the aesthetic is completely different. For example, in the genital area, when we talk about the labia majora, the labia minora in big people, we cannot make exactly the same because we'll find just underneath the skin a large amount of fat. So to put there the stitches, to try to make the shape of the labia minora and so on, we'll find very thick tissues. So it's very difficult not to do it. We can do it in the surgical theater, but after the surgery, in the follow-up, many of the stitches will get detached, okay, because of this large amount of fat that makes it very difficult to put in touch the tissues, to get in touch with them, to try to get a very good result. The result is good. The result is always according with a big person, like for example, a cis woman, but it won't be exactly the same. It's just a question of expectations in this case. That's the first of the problems. So we need to be sure you understand, you the patients understand, the result won't be exactly the same than in a thin person for aesthetic reasons, not for other reasons. We'll find the same anatomy and so on, but we'll find there the anatomy every, for example, cis woman will have in the weight the trans woman has before the surgery, after the surgery. If a person is overweight, you'll find for the surgery in a vaginoplasty the same anatomy in the genital area than a cis woman had in the same condition. Okay, so if you're seeing an overweight woman, for example, an overweight cis woman, they have a big belly, they have a big labia majora, they have a kind of and not that good anatomy to see. So that's why you'll find the same result in your case if you have the same weight than this cis woman. So that's more or less the comparison I usually take to try to explain my patients what are the expectations we can have for an overweight person after the surgery. So first, the expectations. The expectations has to be according with any cis woman or any cis man had in the same weight than the trans person who is asking us for making a surgery on them. Okay, the same results, not that aesthetic than in a thin person. So first, the expectations. Second, the possible complications. In a very big person, the rate of complications is higher. In all the surgeries, in all the people, it's not a question of trans people, it's not a question of gender people. It's a question of all the big people, all the overweight people have more risk for complications. First risk, the infections. The rate of infection is higher because of the deposit of fat underneath the skin, and lack of good blood supply to this fat. So in this case, it leads the bacteria to grow very easily. So one single bacteria along the surgery there, and you'll have an infection. And in contrast, in people with in thin people and in people without this high weight, they have less chances to get these infections, because the blood supply is higher, because the fat is very thin there underneath the skin, and so on. Okay, so higher rates of infections, higher rates in general of complications, such as, for example, in the vaginoplasties, the vaginal strictures. When you think in an overweight person, you know that's an important deposit of fat underneath the skin, so that the tissues are thicker. When we try to get the belly through the external approach, when we try to make the vaginal lining with the skin on the penis, yeah, it's not the same having 15 centimeters in a thin person than have thin 15 centimeters in an overweight person, because you won't get the same deepness because of the thickness of the tissues. Okay, so more strictures in the follow-up, less deepness, and so on. Okay, for the vaginal depth, for example. To work in along the surgery, exactly the same. The surgeons have more problems working in a very in an overweight person with the thicker tissues. It's more difficult. It's not that easy. The structures are not recognized that good and usually. So we can have more complications along the surgery. Even we have a higher risk of finding injuries in the surrounding tissues, in the surrounding organs, in the surgical site, because we don't identify them as we do in a thin person. Okay, because they are absolutely buried by the fat. Okay, so that's very difficult to identify them. We need to work not that fast. We need to work very quickly, very slowly. Yeah, so it takes longer, more complications in the surgical theater. For the anesthesiologists, it's the same. They have more problems for the ventilation. They have more problems to have a very good oxygenation along the surgery. So more problems along the intubation, along the anesthesia as well. And finally, it's very important to understand for the blood supply as well, why we can get more complications along the surgery. For example, in a phalloplasty, when we take the skin and the fat with the radial forearm phalloplasty to make the phallus itself, we'll find there are very thick tissue because of the fat. So the first problem, as we were talking about at the beginning of this conversation, we'll find less aesthetic phallus because of its thickness, less morphologic, less aesthetic, less like usually. And second, as long as the tissues are that thick, when we try to stitch the artery, for example, between the phallus and the epigastric artery in the receptor site, we find there an important amount of fat. So the distance between both arteries is much long than usually. So it's very common to the need to put there another graft, a vein graft in the middle. So it takes longer to do it. We have two stitched sites in the artery. So in definitively it has a higher rate of complications and higher chances to lose completely the phallus. Okay, so that's why in general in all the surgeries, but especially in transgender surgery, to be big, to be overweight means higher rate of complications, less aesthetic results, and even the possibility in the phalloplasty, for example, to completely lose the phallus itself because of complications associated with the artery. Okay, so it's not a question of rejecting patients, it's just a question of explaining that very well. So if you accept these risks, if you take these risks and you accept your risks are higher than usually, then go ahead, come here and have your surgery. It's not a problem for us to deal with big people. We are absolutely used today to deal with big people. We are used to with big people because we perform bariatric procedures as well. So we are absolutely used to deal with big people. That's not a problem for us. It's just a question of having this information. It's just a question of understanding why we take usually more risk in big people than in thin people. For the surgery itself, for the postoperative complications, for the possibility, for example, in the radial forearm phalloplasty to completely lose the graft, the phallus itself, because of artery thrombosis or complications associated with the vessels, and finally, because we are not in situation to get the same results than in a thin person. Okay, but if you accept this information, if you accept this risk, that's not a problem for us. We are used to deal with big people in transgender surgery, in obesity surgery as well. So that's not a problem for us. But you need to understand this information and to accept it. Okay, having a very good, nice day today. A very good evening today as well. And I'll be there in any case in the next days, next weeks, to give you more information about anything you need to know. If you have any idea about what you need to do, what you need to know, just let me know, and I'll be glad to make a new video for you. Bye bye. Have a nice day. Bye bye.